We move quickly on because it's fast paced here, isn't it? And I'm Sarah Blundell and Andy Laval, who are, I'm reading off my sheet now. Both work for NHS England. Sarah is the lead for data professionalisation. Andy is, and I've already seen some of your presentations on this competency framework, data professions already. So I know I'm a big supporter of it, and so really excited to introduce you and welcome you. And I will. There's going to be time for questions. They tell me we've got a nice 25 minutes here for this session, and so at the end I'll be popped back in, and we'll see what questions we've got. We'll have a chat about it. So thank you very much for joining us, and I shall see you near the end.
Brilliant. Thank you, Karen. So as I said, I'm Sarah Blundell. I'm lead for data and analytics professionalisation at NHS England. And Andy, would you like to introduce yourself? Looking very dapper today.
Well, I thought I'd dress up for a conference, I've even got Santa. Andy Lavelle, Senior Manager for Analytical Professionalisation at NHS England.
Brilliant. And can we have our slides, please? Fabulous. So we're here today to talk to you about the National Competency Framework and what's coming up in version 3 of the framework that we've been very busy with colleagues building over the last few months. Next slide, please. So what are we going to talk about today? We're going to talk about what is the National Competency Framework to catch you up for anyone who has been living under a rock for the last few years, or maybe is just new to the NHS. We're going to talk about what's new in version 3. We're going to give you a bit of a recap because we all like methodology about how that content's been developed. Andy's then going to talk about how people are using the framework. But also, obviously, this is not a closed process. We have still got more time for you to have your say about version 3, but also how you can learn more about the National Competency Framework and start your competency framework adoption journey. Next slide, please. So just a bit of a recap for what is the National Competency Framework. So it is a skills and competency framework for people who work across data and analytics within healthcare, within public health, even for people that are working across sectors. Broader than that, we've got people obviously in education and a few other areas that are starting to use it. And what it allows us to do is to articulate and set out skills and competency frameworks that are needed within different roles and at different stages of your career. So it sets it out across 5 practitioner levels, and this is done deliberately so as to align with professional body practitioner statuses, and also to sort of get round that pesky thing of different grades within different organisations, etc. Civil service to local authority to NHS, obviously all have different grade boundaries, and we want this to be able to be used across multiple sectors. It sets them out then for different job families. So we look at the data family, and what we mean by that is a whole range of roles. And traditionally, this is then covered data analyst, data engineer, data scientist, the more established roles. But then in the last iteration, version 2, we also introduced data governance, data ethics, analytics engineer, and machine learning engineer. And these basically then cover everything from band 3s up to band 9s. Can I have the next slide, please? So what's different about version 3? Well, quite a lot. So obviously what we try and do is align up with government, digital and data capabilities within the GDAD framework. And one of the new things that came in GDAD of this year was the introduction of a more specialist role around evaluation. Now, obviously they've called it digital evaluation. We've called it evaluator brackets digital, because we obviously recognise that within the NHS we have much broader evaluation specialists than just digital. We want to make sure that they're included within this. So in line with that, we've obviously introduced this whole new role that covers from practitioner level 1, that entry level position, all the way up to our heads of service in our practitioner level 5, our leading practitioners. And there are 5 different areas that we've included competency statements around. So the context of why and when to evaluate, how to scope and design evaluations, specialist data collections and analysis techniques for evaluation, how to lead and manage them, and then also then how to use and disseminate evaluation findings that really then brings in all those more specialist communication skills that might be needed to communicate evaluation, etc. So that's the brand new role that's come in. Next slide, please. The second thing is obviously we've been extending and revising existing sections of the competency framework. So one of which, again, is responding to the changes within the GDAD framework, one of which was the introduction of data ethics in for data analysis for the very first time. So what we've done is we've created a new competency, DAC7, that reflects that increasing role that data analysts have around data ethics. And this includes things around the use of AI, not just the safe use of AI outputs itself, but also things like AI from an ethics and professional standards. So very much covering that whole, you are able to actually replicate and understand the theory of this. If you needed to replicate it in an alternative program, it might take you long, but you at least understand. So you have got the underlying skills to do these sorts of things without AI, which I think for people working in analysis is incredibly important, that they keep that professional standards and credibility. Secondly, was the expansion out of the data ethicist role. When this was introduced, it was only at that level 4 and level 5 practitioner, and based on that sort of real expansion of those specialist style roles going forward, probably with the introduction of probably more AI specific roles, we have now extended that down all the way down to practitioner level 1, so there's more entry level skills around these areas. And lastly, we've extended out the behaviours framework, which is part of our ancillary framework, to include a new competency, BE7, which is around reflective practice. Next slide, please. So what else has been added? Well, specialisms. So for those of you who are aware of how the competency framework is structured, core competencies are around those core skills that we would be expecting the 90% to be able to do within those roles. And then there are specialist technical skills that exist that will be the flavourings, the thing that might make your role unique and different within a team compared to others, the things that make you special. So what we've obviously done is, in response to some feedback, we have been changing some of the existing definitions. So based on feedback, we've made changes to the advanced statistics specialism and the SQL specialism. What we've also done is, again, based on feedback from the work we've been doing with public health, was introducing 3 new specialisms this time, one of which is skills around responding to consultations, another one is around design and analysis of studies, and then the last one is very much around that broader skill set of literature searching and critical appraisal of those results and research skills, etc. Some of which obviously we've heard some fantastic presentations on earlier today. Next slide, please. So how has this content been developed? Well, we've followed our standard National Competency Framework methodology, which is very much open, transparent engagement, collaborative approaching. So firstly was doing that literature searching of existing content that already exists out there. We don't replicate the wheel. If it already exists, we find it, we bring it in, and we include that along with other core content. So taking things like GDAD framework updates, but putting that alongside literature searching. We had fantastic support from UK HSA this time in order to basically do a load of that work. Then obviously creating initial strawmans and then taking that through workshopping. So we've ran between 2 and 5 workshops for each of the different topic areas, depending on the complexity. That's with bringing representation from across the system to review that, make iterative changes, etc. We're currently then out for user testing with the wider community, and Andy's going to talk a little bit more about that later, but this is then the opportunity for everybody to have their say on what those proposed changes are to the framework. And then lastly, we'll take those final feedback in, make any final changes, have change logs around what we've accepted and why, where things then can be incorporated into the version 3 that gets published on the 26th of March, and where we might take things into a version 4 if it's more complicated for versions and changes. Next slide, please. So we're now over to my lovely colleague Andy, who's then going to tell you a bit more about how people are using the framework.
And hopefully I'm on the screen now. Let me just check. Yeah, so obviously we've got the competency framework, but what you want to know is actually, do people use it and do people find it useful? So we're just going to take you through a quick case study from Arden and Gem CSU. So Arden and Gem have been providing services to, there's over 30 organisations they've been doing. So quite a large organisation, obviously in the CSUs, and now all the CSUs are coming together and then they're all going to disappear, but we won't talk about that just at the minute. But it's how they've been using this to sort of help them understand their workforce, what the structure is, and then how they can sort of help support them in the changes that are going. So with the competence framework, there's a self-assessment tool that people can download. You can go and download that yourself and just complete it for your own purposes. There are add-on bits that we've got that are then for managers to then start to pull together all those individual profiles if they want to then start to say, actually, what is that skill composition and what are the competencies of the team that I've got, which is what they've been doing. So you can see that they started to look, they could see what the sort of different roles that they had were, look at the stuff on the bandings, look at the practitioner levels that people were coming out at, which they were finding really useful just to kind of help structure those discussions. But then they could also then start to drill down into that and say, what are those areas where our staff feel really competent at? What are those real strengths that we've got? What are the practitioner levels that we've got? That then helps them understand when you're being asked to, by providers, whatever, to help support on some of these requests, where those skills might lie, who those people are that you can start to pick up and bring them in and bring their skill sets so that you can use it efficiently. And they were also able to look and say, actually, where have we got areas that we might need to bolster up? What are some of those things that we think we need to develop our skills into? And what are the ones that staff are wanting to bring their skills into? Now, this can help change the way that you're starting to look at the training. So if you know that you've then got a number of people within the organisation who are wanting to focus on a specific area, you then may be able to get some bespoke training in and get some more effective and more collaborative way across the organisation of doing that training. So it certainly helps you identify what those gaps are that you want to train on, and then how you might best be able to go forwards on plugging those gaps. So how they've started to find that that's impacted is that they've, as I say, it's done that ongoing learning and development. They're looking at Python, Power BI, data visualization, those sorts of bits that they want to do. Getting people onto the level 4 data analyst apprenticeship to be able to help build those skills, and looking at the way that that's then able to say, because we did that analysis, because we worked out what those gaps were, we were able to identify the right training for people, and then we were able to put them on a career pathway to develop them and to help them achieve that next step up. And that's really what we all want within the analytics world, is to know, how do I develop my skills so I'm delivering the maximum benefits that I can with the skill set I've got at the minute, and how do I make that transition to the next level that I want to do, and what are the opportunities that I've got within the analytical world to do. If you want to know more about that Arden and Gem case study, it's on the Analyst X page, National Competency Framework. If you're not on Analyst X, please get on Analyst X. It's one of the biggest analytical communities that we have out there for people across health, social care, local authorities, and beyond. We've got police and we've got education. I think Sarah was kind of alluding to before how wide both the framework and Analyst X go. But just some of the things that the CSU had done, they've now got it so that it's embedded. It helps to structure some of those PDP conversations that they have, and particularly at the minute where we're in such a state of flux and we're all wondering what the next step's going to be. It just helps you understand, what are your strengths, what are your core skills, what are the things that you're good at, what are the things that you might want to be looking to develop some training in and to get some more experience of, to help you make that next step, or to help you take advantage of that next career move that you want to have. So it's there, and you can use it at the individual level, the team level, or the organisational level. It works on different ways that you can do it. But particularly if you're on the call today and you're thinking, well, how can I use this? Just go download the self-assessment tool. You can use it and you can recognise how brilliant you are and all the skills that you have and that you're able to take forward. So where we're talking about getting involved, Sarah said open, transparent, collaborative. I put on my LinkedIn post today, this is a framework for the analytical community, developed by the analytical community. This is not Sarah and I that have done it. We rely on the community taking part and inputting and helping to steer this, because it's in all our benefits to make sure that we're talking so much about how much analytics can now start to have this impactful way that it's going to be working on the future of the NHS. And we need to make sure we're as skilled, as fit and match ready as possible to be able to go and deliver on this agenda that we've got, and to really make those impacts that we know and we're really hungry to do. So helping shape this framework is really important. So version 3 is now for testing. It went out on the 17th of November and it will be open until the 16th of January. So over that Christmas period, be able to sit down on Boxing Day and have a look through the competency framework. There's nothing better than doing that on a Christmas period. But you can go and look. You can have a look at the changes that we're making. You can give us some feedback. Even things that have already been there, you can give us some feedback. If the wording's not quite clear, if you think we've missed something, if you think maybe there's a different way of expressing what we've done, this is your opportunity to look and to feed in and be part of developing this framework as we go forwards. So there's no point in June saying, oh, well, they should have done it that way. You know, they missed that. They didn't cover that. Now's the time to get involved. We want your input, because actually it's not just for us to do this, but it's for the whole community. So if you've got stuff that you think needs to be in there or needs to be changed because it's going to make it better for everyone, please do that. There's a QR code there that you can scan. I'll leave it just up there for another second, but I think the details are going to be sent out later as well. And as I said, if you want to start your adoption journey, if you want to join Nico there with your little map to plot out your career, we hold fortnightly new adopter calls. So we also do training as well. So every Thursday, well, probably in about 10 minutes time, but don't go, stay with us for now. But between 12 and 1 on a Thursday, there will be something going on for the competency framework. It's either training on how to use the tool. It's about the new supporters call, where you can come along and find out any questions that you've got, anything that you can ask. And then part way through that new adopters call, we then get joined by the masses. We get joined by those other people that have been using it, the wonderful people from Arden and Gem, the wonderful people from Mids and Lancs CSU, the wonderful people from Imperial, that have all been using this, and they'll come along and you can ask them questions, or they can share things that they've been doing with this as well. So we've got these things, then we've also got all the stuff that's on the Analyst X events calendar, so that we can start to make you aware of what's coming up, what there is that you can tap into. And as I say, you can download this tool now. You can go onto Analyst X and you can populate, even if you just do it for yourself. It's well worth doing, because this gives you an opportunity to benchmark where you are against a national peer-reviewed standard that has been set for these sorts of things. Thank you very much for listening. I can see Karen's just appeared now. My timer was just about to go off then, so I'll turn that off. But that's our contact details if you want to get in touch. And thank you very much for listening. I hope you found it interesting.
I think everybody did. So well done, Andy and Sarah. Thank you massively for that. So we've got a good 6 minutes for questions. So that's really lovely, isn't it, to get that time. So somebody called Patience has asked if you could drop the link, please, because the QR code appears not to be working for her. So if you could do that. The QR code says it's been deactivated. Nothing to do with the CSUs going yet. Anyway, that was a joke based on your joke at the beginning. And okay, so Janet Parr has asked, Steve Wyatt's session this morning was really interesting, and I was wondering how the recommended separation between BI and analysis relates to the competency framework, or if it's something maybe you've not thought about or considered before.
We have. So the irony is the GDAD framework does have those separated. And when we did the initial work 3 years ago, we merged them rather than having them separated, because the reality for the NHS is that the separation isn't there. And our framework is about something that people can use now. So we obviously looked at what the core underlying skills were for data analysts and BI performance. And at the core level, for a lot of the junior level, it's the same. High numeracy, good digital and data skills, etc., the ability to do descriptive and transformation, all these sorts of things, the core skills of that data transformation are ultimately the same. It becomes when you're doing the more specialist areas is where things differentiate. So what we chose to do was we'll keep things in core the same, but we then created specialisms, and the specialisms are there to reflect the different nuances of different types of analysts. So, people would turn around and say, oh, economists should have its own core definition, or OR people should have it. And it's like, well, yeah, in an ideal world, but what we're trying to do is produce something that this is the core that everyone should have. And then these are the things that make specific types of people different. And it might be that if the NHS, and it's a big if, because change is slow, goes down that route of expecting people to have different job descriptions for those roles, that might be something that the competency framework then adapts to reflect. But we don't have any standardization in current job descriptions, and we're trying to introduce that. That's the piece of work that we've got going on with Mids and Lancs at the moment. And our digital professions is to produce standard Agenda for Change approved, panel approved job descriptions based on the competency framework. They aren't even in place. And we know the NHS BSA has done a ton of work looking at, K-means clustering of skills definitions. And the analyst one is all over the piece compared to things like data engineer that's much more clustered. So these types of things, it's still baby steps for us. We want to bring that in, and then we'll put things in specialisms as they come up. And if there is significant transformation where they are really thought of as different roles, but they're not currently, then we would adapt the framework to reflect that.
So at the moment, so would it be fair to say you've gone with the majority, what people need now?
Yeah, we've gone with the 90%, yeah.
Exactly. And if you use the core, then the core is probably works for all. Yeah. And then the specialisms, then layer them on top. So if you are going down the route, if you do have, if you are working somewhere that is unusual in the fact that they have split the two, they've had that foresight to do that, or are about to, or go to, then they can use the framework in that way.
Absolutely. We've always said that it is very much the build a bear, the pick and mix, the Lego build, however you want to do it. It's there to provide consistent language, but how you choose to pull from it is how you would build that relevant to the job that you're actually trying to fill, the role that you're trying to fill.
Great clarification there. Thank you very much. And then the final question in our last couple of minutes is from Phil Walmsley, and he's asked, I'm interested what the flaws are in the government GDAD framework, in your opinion, that motivate the need for a separate NCF for health.
So firstly, obviously, GDAD is built for central government. So it's built around the roles as they see them. So we do influence. So I sit on the GDAD board for data analysts now and have for the last year to sort of start bringing more changes in. But it doesn't reflect the range that these roles do within the NHS and the additional skills and requirements that we have, etc. And because they have that requirement that whatever goes in has to be able to work across multiple government departments, and so it tends to be quite high level, not from a perspective of something that we can then really link through for us into training and targeted. So for us it was about taking that as the bare bones and putting more flesh on it to make it more adaptable for the NHS. So for example, for them, they've put evaluator in, but it's digital evaluator. So they're only evaluating digital products. We know in the NHS, evaluation is a specialist skill area, and we're doing more than just digital evaluation. So it enables us in the NCF to take what they've done, it's a good idea, but adapt it and put that in. So Andy's been the colleague, he's been doing the evaluator build. So, 90% of that evaluator, it doesn't matter what you're evaluating, the skills are the same, but then the digital part is that a separate competency that might then focus on specifics of evaluating digital, etc. Whereas, so for us, if we were just to put that digital evaluating or just use that, then it excludes all these other people that are doing, service evaluation or, these types of things.
So I can see that you're having to, make judgments based on the time, the capacity, and what you're able to do, to manage that.
And what the user base is asking for. Yeah. So it tends to be much more, this is good, but this isn't helpful for us. We start with the GDAD framework. We always start with that as part of our consultation exercise. And then other people make the recommendations for the changes based on what their current requirements are. So
yeah. So thank you both very much. Literally spot on. Time is done now. So again, Phil, anybody that has further questions for Sarah and Andy, go and find them in the chat, in the audience of the way this platform works. My apologies, those are my technical hands. And I'm going to say thank you very much. And could we have our last one before lunch ready to come in?